My name is Lisa Carcifero. I am with the Blackstone Valley Prevention Coalition. And I have Derek on as well. He is our grant coordinator from the Blackstone Valley Prevention Coalition. So I will speak to you a little bit about some of the work that we do in the community and also with workplaces and partners. So to begin at the beginning, we are a regional coalition. We are one of 7 in the state of Rhode Island. Our region is up north, so north of Providence, Burrillville, Central Falls, Cumberland, Lincoln, North Smithfield, Pawtucket, and Woonsocket. We are the largest per capita next to Providence, but not necessarily in land mass. Our mission is to develop, implement, and advocate for effective community-based prevention initiatives. So we work in the community with a variety of ages, kind of throughout the life cycle, as prevention is so important throughout the life cycle. We disseminate information, provide education. We work an awful lot with youth in our communities, and we provide environmental strategies such as media information and work with law enforcement. And we work with all the sectors within the communities, um, including business sector. So why is prevention so important? So I think, as most of us know, it's about staying healthy throughout the life cycle. And it also helps us deal with the risk and protective factors within an individual or families and schools. So we want to increase the protective factors and the things that will mitigate the risks that come up in our lives. So that is our focus. That is what all the science is about in prevention. And also the important pieces with prevention is early detection of challenges or issues. So it really tries to, stave off any kind of diseases that are preventable as we age. And we know that, an ounce of prevention beats a pound of cure kind of thing, right? It's cost effective if you deal with a lot of the issues or challenges prior to them getting much more intense. So a lot of our focus recently has been on the opioid epidemic. Um, we have lost too many individuals. Families are devastated by losses. Communities are devastated. And it affects every level of our communities and society. No neighborhood, race, or class is immune from the effects of opioids and opioid overdose in our communities. The loss is truly immeasurable. So by preventing overdose deaths, we've helped individuals find treatment options, which is the first step to recovery and health. So this is something that's really been important to the work that we do. And we know opioids, while they're effective for pain relief, they are highly addictive and carry such risks. So we'd like to educate our community. And again, it's throughout the life cycle from our youth all the way to older adults. Um, so some of uh, all of the work that, all of the work that we do is built on evidence-based programs and practices. They've been researched, tried and true. Some of the strategies that I wanted to speak about today are the prescription drug take-back days, which we just had one on Saturday, if you've read that in the news. And Derek took the lead on that here in Woonsocket. And then we had other and law enforcement and police departments working with us. Count it, lock it, drop it campaign, lock bag distribution. Over the counter doesn't mean on the counter initiative, and then other various community presentations that we do, especially with older adults. So the prescription drug take back day, it It really is important because it provides a safe and convenient way of disposing of expired, unused meds. How many times have we been prescribed a med that might not work, but then we say, well, gosh, what am I going to do with the rest of this kind of thing? And instead of keeping it in your homes where it may end up getting diverted or in the hands of a child or even a pet or someone that really shouldn't have it, it's best to get it out of our homes. So in April and in October, there are drug take back days. April, I always say, is, medicine cabinet cleaning, spring cleaning. So take a look at what's in there and just get rid of what you don't need, what might be expired and unnecessary to have. And in that way, it protects public health and safety. And these 2 days each year give us an opportunity to raise awareness, and we partner with the Drug Enforcement Agency and our police departments. And we do a lot more throughout the year, but at least these 2 days are really very visible. And by removing them, it really helps us to keep it out of vulnerable populations' hands. It's really proactive and it promotes an overall healthier community. So the results of our region, and there are statewide results available on DEA's website. These are the results in our region. Burrillville may not have met the deadline because you have to turn it in by that day to get it on the list. But this is an awful lot. When you think of a pound of medication, when you think of either a pill, that's an awful lot when you measure it in pounds. So, to be able to take, well over 200 pounds of medications out of people's homes, that's an awful lot that we don't divert to places where it really shouldn't go. So kudos to all the police departments and all of the prevention and agencies that have worked on this. Our next strategy is a campaign that we began a few years ago, and this is again statewide efforts, and it's called the Count It, Lock It, Drop It. So anyone that has any medications in their home, whether they're opioids or anything, should know how much you have and where it's being stored. Make sure it is locked up or in a place where it's not accessible to any of our kids. I always say, including our older adults, just don't leave it on the counter. You don't know, even visitors, you just don't want to take any chances of anyone, something that they might need if it gets, if someone takes it and then they're without. Especially we know that, the pharmacies, they keep track of, how much meds go out to individuals and they won't refill them until it's time. So with seniors especially, don't share them, don't leave them on the counter, don't always know where they are and count them and know how much you have. And then when you don't need them, dispose of them. But disposing of them properly is really important. So we offer these lock bags free of charge to anyone, any organization. We can send multiples, and people can lock them and keep them in a safe place. So on the next slide, there is a QR code and you could just fill that out. We can send them out, and they have different resources and materials inside that for individuals. We also include our campaigns to remind people not to keep things on the counter and to lock it and drop it off and keep them in a safe place. And there's also disposal sites. So most of the police departments have a disposal box in their when you walk in the door, maybe in their reception area, and they're open 24/7. So people can go in there. You don't have to put your name. You don't have to say what's in it. You just drop it in the box and it's done. So again, getting it out of people's homes. So that's the Count It, Lock It, Drop It campaign. So it's a QR code. I don't know if anybody's interested. We can send all this information to you, but again, people can request a bag. And then this is simply the over the counter, does not mean on the counter. So when people go to buy, whether it's cough medicine, cold medicine, Tylenol, anything, that can become dangerous for people in large quantities. So especially children, and we know they're curious. So trying not to leave. I remember, growing up, my dad had his stuff right on the counter. And when you think about it, it could be a dangerous place for little kids, even pets, or people visiting that, may or may not touch other things on the counter, let's say. So that's our reminder to everyone. So here we do reach out to workplaces and our partners in the community, and some of the materials that we provide as resources are in here. There are also resources for referrals if individuals feel that they may want to get some support or in recovery and want to reach out to other organizations for that. But it's information not only on opioids, but also on stimulants. We know people are using energy drinks, and those can be dangerous, especially for those that have any kind of heart conditions or any other kinds of pre-existing. And our kids, right? Our youth are big into the energy drinks. And also those in colleges and students that are up late using the Adderall and other kinds of ADHD medications. So we provide information on that. We also provide information on marijuana, or cannabis, mental health, any kind of substance use, nonviolence, understanding pain and managing that in other ways, among other resources. And some of the work sites that we have worked with in the past, and this is just a small list, are listed here. Derek's been going out to one-on-one to speak with individuals within work sites. We can send things in the mail, we can send an email, but to be sure somebody has it in their hand, there's nothing better than that one-on-one face-to-face contact, and kind of letting people know some of the resources that we have, and they're available at any time, whether, excuse me, it's on our website or by a call or an email or text, and we can drop things off and send things along. But we work both with public businesses or public locations and organizations, as well as private. And what we'd like to do is go to places where people gather, or where there are bulletin boards where they can display information, or have maybe resource tables, or a place where we can put the materials and have an opportunity to speak with the manager or someone there that we can really send a message to, especially about prevention. If COVID taught us nothing else, it was about the importance of prevention, preventing things. We had to distance. You remember the masks. It was all about prevention. And prevention is so important throughout the life cycle. From when a baby's born, we begin with our prevention, right? We're teaching them about the good things. We're trying to protect them. Not, don't touch this, don't touch a hot stove, don't put your little finger in the socket. Like, prevention is so important. We go to the dentist, we brush our teeth every day. We wear a hat when it's cold out so we don't, lose our body temperature and get cold and maybe catch a cold, or, those kinds of things that we learn along the way. And so to have an opportunity to speak with people one-on-one is always optimum. So, some other things that we provide here are just some of the resources. We also are happy to do naloxone training, understanding opioids and opioid overdose. So we have these are just some of the resources that we distribute, even to doctors' offices, dentists' offices, and I'd be happy to provide this to anyone here. The other evidence-based strategy is presentation to older adults. As I mentioned, this is a population, as we age, sometimes we need a few reminders, but there are a couple of things that we do. We do an evidence-based program, which is called Bingo Size. That is, we go into a community and we oftentimes work with the senior center or high rise, and older adults can sign up, and it's blending bingo, which is fun to that particular age group often, and with some exercise as much as they can do, with education. So we're educating them on fall prevention, nutrition, and also how to count it, lock it, and drop it, how to manage those medications in their home. So it's really a prevention based, and it's fun because they're playing bingo and they're moving. So they can do, chair movements, or they can stand up, whatever they can tolerate. And we have two individuals. One is a trainer that runs the program, and another is her assistant. So we go out to the different areas and municipalities. And the other are older adult presentations that are specific to staying healthy and safe and kind of managing their meds, especially any opioids in their home. And it includes, naloxone training and availability of naloxone, so we can distribute that at the same time. And it really is, we target the more vulnerable populations, and also education really allows them to protect themselves and others and family members. And one of the important things is with our older adults, we find is they often, because they're on such a, they don't have as much disposable income, they tend to share their medications. If one says, oh, I had a backache and my doctor gave me this, use this, you could try this and it'll help you too. But without realizing how medications affect some of the pre-existing conditions they may have, or other medications that they're taking. So doing some education around that has been important. And then, again, education face-to-face is two ways. They can ask questions. It's pretty direct, and then it allows experiences to be shared. Like, this happened to me, and would you handle this kind of thing? So that's another piece. So those are just some of the strategies that we use to connect with the community and different populations. This is contact information for both myself and Derek. And so we really welcome you to reach out if you have any questions. And I thank you for giving me a few minutes of your time to present today. And that is it for me. Does anyone have any questions?
Thank you.
Thank you so
Thank
much.
you so much. Oh, sorry. Thank you.